All right, I think we've got a critical mass here. Welcome, everybody. Thank you so much for being here. Welcome to the EI Café webinar series. My name's Annie Henderson. I'm the Executive Director of EI, and we're joined here tonight by members of EI's board, staff members, students, friends, volunteers, and stakeholders. Two of those members include our esteemed panel guests, Dr. Jennie Lane and Dr. Angie Varnum. Dr. Varnum serves also as EI's Education Director. So on behalf of all of us and the EI community, thanks for joining us tonight. You're probably here as a professional within the working Equid community, a supporter, a stakeholder, a volunteer, partner, or someone interested in the well-being of working Equids. And this space is an excellent opportunity to learn more about the work EI does, to meet others invested in working Equid health and welfare, and to reconnect with why it all matters. EI seeks to develop a community for professionals in working Equid welfare in a cafe-style space to share challenges and strengthen success. The webinars are offered once every other month on the third Wednesdays of each month. Our next one will be in June, so mark your calendars for that. If you have any suggestions or requests for future topics, please email Dr. Angie Varnum, whose email address we'll post in the chat. And that's the best way to reach the organization. Tonight's webinar is a panel discussion, and we invite you to submit any questions you might have in the chat. We will do our best to answer both the questions submitted in that chat, and then also there have been questions that have been submitted prior to tonight's discussion. So if we don't get to your question tonight, again, we do encourage you to reach out to Dr. Varnum with the email provided, and we'll do our best to continue that robust conversation even outside of this space. Before we jump in, we do have a few small housekeeping items. The following are expectations we have of you as a participant. Microphone muted is best, so we don't capture all that background noise. If possible, turn your camera on so we can see who you are and connect with our other colleagues interested in this work. Of course, sometimes we know bandwidth is limited, so we trust you to use your judgment. Of course, again, post questions that you might have in the chat. And then also, just so you guys know, tonight's webinar does not offer CE. It will, however, be recorded and shared later. The panel discussion tonight is one we're really excited about. It's One Health and Working Equids, and it will serve as a strong introduction to the concept of One Health and explore how veterinary medicine and working equids are both deeply intertwined in this global approach. Before we introduce tonight's speakers, we'd like to remind you that tonight's webinar will be recorded. So all those with the who have registered, and we'll get that link within 72 hours. So you can share that amongst your friends and community. And again, thank you guys for being here. Without further ado, I'd like to introduce you to our panelists, Dr. Jennie Lane and Dr. Angie Varnum. Following a brief introduction, both Dr. Lane and Dr. Varnum will deliver short presentations followed by our panel discussion. So up first, Dr. Jennie Lane is a public health veterinarian based at the One Health Institute at the University of California, Davis. She obtained her veterinary degree from Michigan State University and worked in equine, ambulatory, and small animal practice prior to pursuing a master's of public health from the University of California, Berkeley. Jennie first became acquainted with the Equitarian Initiative work after attending an informational session at a veterinary conference and attending an Equitarian Initiative workshop in Veracruz in 2011. Her experiences working with EI and other veterinary groups working with working equines inspired her interest in One Health and desire to learn more about the impact evaluation and the linkages between working equine health and human health and livelihoods. Her MPH research focused on the linkages between working equine health and human livelihoods in Nicaragua. After completing an MPH, Jennie worked with Land O'Lakes International Development on livestock development and human nutrition programs across East Africa. And in 2017, she joined the One Health Institute at UC Davis. She currently supports several training and capacity building programs related to infectious disease surveillance, global health security, and One Health, and works with the One Health university networks in Africa and Southeast Asia. Our second panelist, Dr. Angie Varnum, is, as I mentioned, the Education Director for the Equitarian Initiative and works in private practice in Minnesota as a large animal ambulatory veterinarian. She became affiliated with the Equitarian Initiative in 2010 during a previous career as a Spanish teacher, then went on to receive a master's in public health degree in 2017 and a doctor of veterinary medicine degree in 2019, both from Colorado State University. She conducted qualitative research for her practicum and capstone projects for her MPH degree alongside the Equitarian Initiative in Peru and with indigenous horse cultures in the United States. Her current focus on education for the organization encompasses international veterinary student programming and curricular support, also community education techniques and volunteer management. So again, thank you both for being here, and we're going to go ahead and start with Dr. Jennie Lane.
Thanks, Annie. Hi there, everybody. Good evening. Probably most people I'm imagining are joining from somewhere in North America, or at least the Western Hemisphere. Let me share some slides. So, can you see those okay? All right. I wasn't nervous until I saw Dr. Schott join in the participants, and he was one of my professors at Michigan State, and all of a sudden it was like immediate sweaty armpits. So let me just pick
Don't worry, Jennie, you'll do well.
It's crazy how like that was I graduated in 2007, and like there's just like this like you revert already. It's kind of amazing. I haven't had an experience like that in a while. So it's such a pleasure to be here, and I'm very honored that EI invited me to present with Angie. I'm going to give sort of a high-level overview of sort of what the heck is One Health and maybe a working equine lens on One Health, and then pass it over to Angie. Well, we're going to have lots of time for questions, so if I don't get into stuff while I'm presenting, just please use the chat. And hopefully we'll have some time to have a nice, robust discussion. So I'm going to start off with a very, this high-level definition from the United Nations quadripartite One Health high-level expert panel. I'm not going to read all of it. Really, at its fundamental level, One Health is an approach that recognizes that the health of human people the health of humans, animals, and ecosystems and their shared environments, and including plants, are all interconnected. And One Health is an approach that, so I bolded the middle sentence, mobilizes multiple sectors, disciplines, and very importantly, communities at varying levels of society to work together to sort of address these really complicated challenges and threats to health and well-being and ecosystems that we are facing on our planet. There are other definitions out there, but this is sort of becoming sort of the global standard of what the One Health approach is. And this definition sort of was just most recently sort of modified and came out in 2022. So this is a diagram from that same group that just sort of illustrates how the sectors and disciplines work together with society, lots of collaboration, capacity building, coordination, communication to try to improve One Health outcomes for all the creatures and things living on this planet. So why, what are those challenges? I think we're all really familiar with those. Our planet faces some really big things to address, including zoonotic diseases, antimicrobial resistance, health disparities, food security, water security, poverty, climate change, and all the impacts that are going to come along with climate change, biodiversity loss, habitat loss. The list is pretty long. They're complicated challenges. And society is recognizing that we need to come together across disciplines to address some of these big challenges. A little bit of history. So back in the 60s and the 70s, some pioneering work by a man named Calvin Schwabe at UC Davis sort of started the birth of One Health. It wasn't called it then, but it sort of started to emerge then. I mean, One Health in itself is not a new thing. Indigenous cultures for millennia have recognized that the health of humans and animals in the environment are interrelated. Like that's not a new concept, but the Western world has put terms around it sort of in the more recent decades. It wasn't until the early 2000s that the term One Health really started to appear in the scientific literature, and it was first associated with sort of the high pathogenic avian influenza outbreak in the early 2000s. And then it sort of gained traction in the wildlife ecology and space, sort of in the wildlife conservation space first, driven really by wildlife and veterinary professionals, focused initially on zoonotic disease and emerging pandemic threats. It's been recognized that that approach has been sort of a good and useful sort of platform and framework to address some of these other major challenges the globe faces. So that's just a little bit of history. As Annie described in my bio, I've been working with working equines for quite some time. Right after graduation, I was in equine practice, and during my vacations, I started doing some work with different volunteer groups working on working equines, not just EI, but a couple other groups as well. And it just, that over years of doing some of those trips really sort of inspired my interest in trying to understand the linkages between working equine health and human health, and really how to actually evaluate impact of equitarian type programs on not only working equine health, but the broader sort of livelihoods and the communities that those animals are part of. So all of that over a course of a couple of years made me decide to go back to school. So I got a master's in public health, really focused on looking at the linkages between human health and working equine health and human nutrition and livelihoods in a couple of different communities in Nicaragua. And I'm not going to dig into that, a lot of that research right now. I learned a lot as a master's student. Master's projects are often not published because you learn a lot through the process of it. But we have there is an AAP proceedings that we'll put the link in the chat afterwards that's related to that research. But needless to say, I've had the opportunity now to work with and sort of just see working equines in lots of different parts of the world. And I picked this selection of pictures that just sort of highlight all of the different elements that working equines sort of touch across the One Health sphere. So related to women's empowerment and food security. There's the donkeys in the upper left, those are water jugs that those donkeys are carrying in Ethiopia. On the right hand side, there's some donkeys pulling a cart that's in Malawi. Pulling firewood, taking bananas to market. That's probably coffee in the other donkey picture with the women, and then milk being taken to market in Mexico. So that has cross-cutting things across food security, environmental degradation, livelihoods for the families that depend on these animals, water safety, water access, women's empowerment. A lot of these donkeys probably are also generating income that households use to buy other food, to buy soap, to pay for kids to go to school, healthcare, roofs on their houses, lots of different things. So it's really very interconnected when you start to sort of dig down and understand how those working equines sort of fit into the community where they live. And this is just a picture that I think really highlights it. So these donkeys are pulling some maize. So this is in Malawi at the harvest season. And that sort of is their version of a silo. You can just imagine sort of the losses that you might have to pests and exposure to the elements outside. And it's a full sort of silo versus a very empty silo at the end of the year. And you can just, if you don't have a donkey taking the maize to your households, it's usually women and kids carrying it there. And I think we've probably all seen different versions of this in the communities that you've been to in the past. So it's not just the working equine health, it's food security and the livelihoods and really the survival of families that eat that maize for the duration of the year. Like I mentioned, I think I'd be remiss for not sort of mentioning this. One Health sort of really came to being related to infectious zoonotic disease research. And I think we do need to remember, a lot of us are probably veterinarians or animal healthcare professionals in some realm. There are a lot of zoonotic diseases that horses can trade with humans and sometimes vice versa. And at the bottom, I found this fairly recent review. At least 56 diseases in that list could be are considered equine zoonotic diseases. So that's pretty remarkable. We don't see all of the diseases there in the United States, but they're certainly present sometimes in other parts of the world still. This is sort of a diagram that I think just helps really illustrate the positive and the negative sort of connections between working equines and human health and well-being. So working equines can do a lot for families through all of the different activities that they do to sort of along the value chain. But then there are also sort of negative externalities associated with working equines on families and their well-being. And to sort of make sure we maintain a One Health lens, I put the picture of the dry sort of cropland waiting for rain to remember that they sort of exist within this environment too, depending on where you are in the world and what ecosystem you're in. Those environments look a lot different, but they're often very arid and depending on rain-based agriculture. And then when you consider sort of a livelihoods framework, I think it's helpful to sort of break out all of the different components that working equines can contribute to different livelihoods across the human, natural, physical, social, and financial sort of categories of how people achieve their livelihood and survive in different communities. And then this question, this slide is, there was a question in the registration, and I wanted to address this ahead of time because I think it's a helpful way to sort of look at how working equines are very cross-cutting across a lot of different issues. So these are the Sustainable Development Goals. The United Nations set these in 2015. We are, as a global community, all of countries are trying to achieve sort of equality across all of these goals. And when I reflect on them, I think that working equines really contribute to almost all of them in one way or another. And as we, as practitioners and those working with communities that have working equines, think about like a framework of how to maybe adopt One Health approaches within your work, sort of reflecting on this is sometimes a good place to start. So I'm going to stop there. And I'm going to turn off my screen share. I'm going to pass it to Angie so that she can tell you a little bit more about EI's space and work in this space.
Thanks, Jennie. And it's a pleasure to follow Jennie, as I will blame her for my interest in this topic and to EI in general for my interest in veterinary medicine, and Jennie in particular for my interest in global health and One Health. So I'm speaking on behalf of the organization. Much of this is not my own, and I hope to represent well what some of the most active and hardworking members of the organization are currently doing, as well as others, for working Equids in the One Health space. Although I blame Jennie, some of my interest in this concept of One Health, I didn't know to call it that, came from my time living in South Dakota. And I was fortunate to have the experience to meet many members of tribal cultures located within the geographic boundaries of South Dakota, which were home to people who had utilized the horse for many, many, many years. Unfortunately, youth and adults, of course, but especially youth in some of these reservation areas are struggling with unprecedented threats to both their physical and their mental health, in part because of historical traumas, a lack of nutritional food options, and other factors. The point of this slide is to introduce one way in which the Equitarian Initiative is supporting One Health efforts, but I didn't really know to call them that at the time. The Equitarian Initiative has led an animal health program, an Equid health program on the Pine Ridge Reservation for many years in conjunction with the Horse Spirit Society. And the photo at the bottom is a group of youth and adults who are partaking in a cultural historical ride to commemorate the taking of their lands and cultural genocide. We learned from these individuals the importance of the horse culture for connecting youth with their culture of origin, and we've seen that played out on other reservations as well. On the left, members of the Sinti Gleska University teach youth many skills, including horsemanship skills, as therapy in their own communities. And on the right, this is a photo from Project Help on the Cheyenne River Reservation, again, working with youth to give them tools to exist in a culture which may no longer feel their own. And I will say that the Equitarian Initiative's involvement in these type of initiatives is growing, in part thanks to Dr. Judy Backer and her support of the Horse Spirit Society. And what some of this looks like is additional funding for programs like this, of course, care of the horses so they can keep caring for the humans, and some collaborative research in a collaboration with some researchers from South Dakota State University and other researchers about the factors that are important in shared health between the humans and the equines. The next segment is mostly reflecting the work of these two individuals, Dr. and Master of Public Health Stacy Tinkler and Oscar Aragon of Innovar y Compartir, a non-governmental organization in Peru. I completed a master's project in Peru in 2016. I wanted to set the stage by mentioning this qualitative study, although Jennie, you're totally right. Sometimes we learn a lot and then we don't do a lot with our research in our master's degree. Not really to tell you about the study, but to set the stage for what came after. And I won't take the credit for this, but I will use it to introduce some of the important work that's being done by the Equitarian Initiative here. The purpose of this study was to describe working Equids contributions to livelihoods, which I represented, or I chose to study using this framework, which is the Sustainable Livelihoods Framework. But what I learned was more about working Equids help for populations who are at an increased risk of suffering due to climate change. So I'll explain that here. I conducted ethnographic interviews with working Equid owners and community members who worked in tourism and agriculture in 4 communities in the mountainous region surrounding Cusco, Peru. Like on your way to Machu Picchu, you might stop here as a tourist. The EI is ultimately granted access to this region and supported, their work is supported by the local civil organization Yanapana, which exists to reduce extreme poverty via sustainable community development. What I learned at this time, which was just 8 years ago now, was that recent climate variability and decreased harvest meant that agriculturally dependent individuals had adapted by engaging in increased tourism in this area. The way that they were engaging in tourism was through hauling tourists and their supplies using working Equids. So the importance of livelihood diversification, or being able to do 2 different things, was supported by working Equids in the face of climate change. I conducted the study in August, in the middle of the highest season of working Equid use, when they were being used both in the fields, in tourism, and in planting. Tourism is outside of the rainy season, however, when really very little work can be performed. So animal owners could relatively easily at this time transition to income generation based on any changes in rainfall, as Jennie mentioned earlier, affecting their ability to be productive off of the land. And this is my point that was made earlier. These are some quotes that I heard from the participants, emphasizing the Working Equids uniqueness in being able to pivot in this way. So Working Equids in tourism replaced the harvest for crop producers in 2016 by allowing an income to be made as what you would call a muleteer in the tourism industry. However, we as animal health professionals know darn well that the same climatic phenomenon that was affecting the ability to harvest agricultural products is also affecting animal nutrition. So they're laboring here at the balancing point between traditional livelihoods and entrepreneurship. They're softening climate factors, which lead to vulnerability of humans. But there are a lot of environmental challenges in this region with keeping working equids for work. A policy brief, in part by the team represented here, was prepared and presented to the owners of the major tourism companies in the region to request greater support of working equids, and particularly support for nutritional and environmental support in their region of work. And then we started to partner with another organization, which I'm going to segue to here. The Equitarian Initiative, in conjunction with the local Peruvian NGO, Innovar y Compartir, conducted a broader survey of the factors in animal health and human health in the region in 2018. The chart on the right shows just a snapshot of what was found. Many factors were studied in the region, which was the first survey of its kind here. But notably so, the chart here shows that the use of the lands among those who were surveyed in 3 different regions of the Andes in Peru. The first is wasteland, the second is pasture, the third is forest, and the fourth is agriculture. So you may be surprised to see the high percentage of pasture use in this situation, in this context, given the fact that we are telling you that the working equids were suffering to get enough to eat. What we found, or what Innovar y Compartir found, is that the feeding of horses is not adequate due to families prioritizing other species like cattle, sheep, and guinea pigs to consume the higher value forages and pastures, such as alfalfa and ryegrass, of course, because they were seen as productive members who could produce meat or milk. Although there is lots of pasture, the carrying capacity in 2018 had been totally obliterated. They were overgrazing nearly every hectare, due in part because of an absence of planning and other practices. And this ultimately led many of the muleteers, or the working equid keepers, to comment that working equids, in fact, are degrading the land. So instead of being seen as a tool in adapting to climate variability, they're being seen as treading too much and disrupting the soil and leaving very little room for pasture to continue to grow. And we know, of course, that that's probably because of overpopulation and overgrazing. So as a result of this research, there was a call to promote programs or projects which relate equine ownership as an adaptive strategy to climate change in this area, and also programs that emphasize planting cultivated grasses and recovering natural grasslands. Well, then we reached this year, and the Equitarian Initiative pivoted more in support, since the Equitarian Initiative's ongoing annual veterinary campaign in this region was suspended. The Equitarian Initiative began instead to supply a food distribution campaign to about 100 families and working equid owners in a rural area, again, headed by Innovar y Compartir, which was requested by this local organization. And this was in response to many, many working equids being lost or killed in this region during the pandemic because of a lack of work for them, aka no tourism. In 2021, the Equitarian Initiative partnered with the Donkey Sanctuary to fund an Innovar y Compartir sponsored program for nutritional security for working equids in a region of Peru known as Maras. This is a very donkey-heavy region that previously had some conceptions of feeding donkeys as being a species that could subsist on a lot of fiber. And what this campaign looked like was the kind of threefold: the construction of some donkey shelters, encouraging donkeys to have a place to get out of the rain, but also a place to be confined when they are not grazing. A second aim of this shared project was the distribution of improved forage seed to about 15 families in the region, and help ultimately with cultivating this donkey feed in the form of some sprinklers and other agricultural techniques. Ultimately, this work is ongoing up to today, and the Innovar y Compartir remains very active in this region in both surveillance and education. In 2024 and 2025, what that will look like is the training of community animal health workers and technicians, in part with a nutrition emphasis, as I am getting at here, to not only impact the health of the working equids, but also hopefully the health of the ecosystem, which supports them and their humans. So there are probably many more examples from other individuals within EI and many of you here, but that's ultimately my goal, is to share a little bit of what's possible when taking a One Health lens, and hopefully spark discussion about where we're going in the field of One Health and working equids.
Fantastic. Thank you so much, both of you, for that fabulous introduction and some really wonderful examples of what this can look like. We're just going to go ahead and dive right in. And Angie, I'm going to start with you. Can you tell us, what is a One Health practitioner and what essential skills or abilities are required to be a One Health practitioner?
I had a colleague once, and I've shared this with both Jennie and Annie, comment to me that the foundation of One Health is communication. As we are exploring ways to incorporate One Health training in our veterinary student initiatives, I've thought a lot about this, and I will, if it's all right with you all, I'll put up one last slide that I had prepared regarding this question. Oh, maybe I can't figure out how to do that now. I'll summarize visually. Some of the core skills, in my opinion, to work in One Health include effective communication and ultimately collaboration. It takes a lot of what they call resilient working, or a willingness to keep knocking on a door until you find the right person or the right group to collaborate with. and recognizing when you are not that one, which kind of hurts. I think the aspect of education, an additional aspect of education that I take from the field of education, and I try to apply it to One Health, is a reflective practice, always going back and learning from our mistakes, which sounds really fluffy, but when you're tackling really difficult problems that exist across cultures or exist across groups of beings, I think the strategy of recognizing what you don't know and coming back to reflect on that and who maybe knows better is of monumental importance. And we're not trained to do that always when we're trained as scientists. We're of course trained to find and know and always get to a diagnosis. But sometimes it takes a little bit of a different approach as far as, I'll just say it again, it's collaboration at its core.
Wonderful. Thank you, Angie. Jennie, we'll direct this one to you. You know, you've been a part of a lot of different teams working on One Health, and what has been the most important skill or perspective that you've brought to those teams as a veterinarian?
Sure. So I have some thoughts about the first question too, but I will start with, I think, what I bring most strongly as a veterinarian to One Health teams is my strength in systems thinking skills. So in veterinary school, we're taught to think about systems and how sort of the different body systems relate to one another. I grew up working with dairy farmers, and sort of my first introduction, I didn't know I didn't think of it as One Health then, but my first introduction to One Health was really working on some small rural dairy farms in upstate New York, and the veterinarian that I was riding along with, this was when I was an undergrad student, said, okay, so the exam of this cow is going to start when we drive in the driveway. And, you know, really looking through at the entire system, what that farm looks like, where the food comes from, where the water's coming from, how they manage the manure, what's their milking parlor look like, what are they doing with their sick cows, what do their healthy cows look like, where are their calves managed, like all of these different things. Sort of I began to understand that system of how the importance of the interconnectivity of everything. And I bring that lens to lots of different One Health teams that I am part of. And I can apply sort of that to a lot of other different types of problems and trying to understand the root causes of things. Chopping up on sort of Angie's question, I was really thinking about sort of the skills and abilities. So I think curiosity and humility are really critical for all of us working in this space. Those are both good characteristics of, I think, most humans. And understanding and recognizing the importance of the role of the social sciences working in One Health, and the importance of really deep community engagement. And I actually just heard an interview yesterday. It was about the Ebola response in West Africa to the Ebola outbreak. And really what got to the bottom of that was social scientists working in communities and developing approaches to the respectful burial of deceased individuals who died of Ebola, because they found that the biggest points of transmission were the women, especially the women who were going through their traditional burial rituals of cleaning and dressing the bodies for the burials, was how they were really how they were spreading the disease the most, that in healthcare facilities to healthcare workers. But it was only through really deep community engagement and the role of social scientists in figuring that out and coming up with a solution that worked for the communities that slowed the transmission in West Africa. So I think that just sort of highlights the importance of of community engagement. And there's lots of examples of other examples in the literature around that too. So I just had to write a review of something. So I learned about rinderpest, and rinderpest was a really horrible disease of livestock and wildlife, cattle specifically. And it's one of the only diseases in the world that's been eradicated. And it was finally eradicated with community engagement and community animal health workers in South Sudan, and learning the epidemiology and actually getting access to really rural and remote communities that were very skeptical of veterinary care. So I think those are some good examples. Sorry, Annie, I kind of went off on a tangent.
No, that's fantastic, Jennie. And I really like what you said about your comment to needing to possess curiosity and humility. I feel like, similar to EI's work, that really describes nicely what some of this requires to have the will and the interest and the curiosity, and also to place yourself into an environment where you just simply aren't going to have those answers. And it's such an important part of making headway in this field in general. Angie, do you have anything to add to that about the kind of perspective you've brought as a veterinarian to any teams you've served on?
I will say that I have not yet lived in teams where I was the only veterinarian. Where I have lived are teams where I maybe was the only non-veterinarian, or before I subjected myself to that training. And what I feel that I can bring is I feel I'm most productive when I feel like the idiot in the room. And what I mean by that is I'm surrounding myself with people who know more about a topic than I do. And that can look like, working closely with, in the examples that I gave earlier, that can look like working closely with animal nutritionists. And in fact, I feel like an idiot on the daily in my clinical job. I'll say working with dairy cattle, Jennie, and the importance of nutrition especially for that species here in the US. And I would just be, I would be lost without the ability to rely on that perspective. It can also look like working with community development specialists, economists. Sometimes I joke that I'm going to loop my brother in because he has no interest in working equids or livestock really at all, but he takes a very economic lens in how he looks at things, and I usually feel like the idiot in the room with him. So I think it's helpful to work with many different professions, not just human doctors, although they are important too, to accomplish the goal of One Health. And the more you can subject yourself to not being the expert in the room, I think the better outcomes that are waiting for you.
That's great. Thanks, Angie. You both mentioned a little bit about women and the One Health space. I'll direct this first to you, Angie. What is, from your experience and understanding, the role of women in One Health in communities with working equids specifically?
Well, they seem to have the answers a lot, don't they? And I mean that genuinely. If we enter a community and we host a focus group, oftentimes we're missing the true contributions of working equids to that community if the males are speaking primarily. And we know that's a dynamic that exists in many cultures. And so when we listen to women, we learn some things about what working equids do to take the daily burden in maintaining a household off of their shoulders or their backs. And Jennie had reminded me of a very important report put out by the Brook called Voices from Women, which goes into more detail about the contributions of working equids to women's lives. If you're interested in not only a One Health, but a One Welfare lens in some of these topics, you know that we kind of find a two-way impact here, that working Equids can help women diversify what they're able to do in a day, and in turn, working Equids that are cared for by women, and in fact, many species, including dairy calves, in some cultures receive a different type of care than the animals who are raised by males, including an important aspect of their welfare just by the husbandry and level of detail that is provided. In many cultures, working Equids or children are the ones, of course, caring for the animals and mostly using them for work. So like I mentioned at the beginning of the question, it's just really important in some spaces to ask them and make sure that women are represented. There's some data to suggest that women who, groups who are seeking input from community members could potentially benefit from ensuring at least 1/3 of women are in attendance, to ensure true participation of the women, and that they're feeling comfortable to speak up in front of the group. It's more from the field of community engagement, but I found that very interesting.
Wonderful. Jennie, do you have any follow-up to that question or discussion?
I would say so. There's really good evidence that the impacts that we know sort of as a global community, the impacts of climate change are going to disproportionately affect poor and marginalized communities. And that within those communities, women and children are going to bear the worst brunt of some of those impacts. And that same population is most often the populations that are relying on the labor of working equines. So I think that's an important sort of thing to remember, tied into what Angie shared just about the role of working equines can empower women to be able to sort of spend time doing other things that also contribute and improve their household health and livelihoods. So I think that just sort of thinking about how sort of the linkages between women and working equines is really important, especially in sort of poor and vulnerable communities that are also going to be affected by climate change.
I'll add an additional comment there, that the UN in 2023, in partnership with some of the members of the International Coalition for Working Equids and World Horse Welfare, hosted a side event on women, water, and working animals that I believe is available for viewing as a recording as well, about some of those same themes, Jennie, that you were mentioning.
That's great. Thank you for sharing those resources. Kind of similar, to follow up that question, we'll direct this one to you, Jennie. What's the role of policy in One Health work? What are we kind of seeing on the global scale and for the recognition of One Health?
Yeah, so there's actually been a lot of effort in this space, especially in the last decade, I'd say. And, I forgot to mention in the introduction, but I think the term One Health became much more of a household term after COVID, and we all sort of lived through that. And the general population learned about zoonotic diseases and the role of sort of wildlife and ecosystems in infectious disease in humans. So, but before all of that, there have been, and sort of since then, there has been a lot of momentum around sort of global level One Health policy setting. There is sort of the US CDC and other partners in, I think around 2015, were involved with something called the Zoonotic Disease Prioritization Exercise, which works with national level governments to prioritize zoonotic diseases in their country. Those are often focused on livestock diseases, but many times also, in fact, working equines. And there have been a fair number of other sort of high-level policies, especially related to sort of global health security, that acknowledge One Health. The Biden-Harris administration has One Health involved in sort of at high level, sort of national policies within the United States too. And I'd say actually the US is a little bit behind some other countries when it comes to adopting sort of a national level One Health approach. We aren't there yet. In other countries, especially Africa, Southeast Asia, there are sort of national One Health coordinating bodies and national One Health plans that are policies that then sort of fall, that help drive sort of national mandates and sort of ministerial level sort of actions and plans. So it's not necessarily filtered down to, I think, the working equines yet, necessarily in some places, but I'd say it's coming.
That's great. I'm glad to hear that that's making its way into the policy space, and hopefully the US can catch up. We can do it. Angie, I'm going to direct this one to you. Kind of gets into what's the importance of animal welfare and risks to nutrition in working equids as it applies to One Health.
Well, I'll just be frank to say that one of the key learnings in amongst many equitarian program locations throughout Latin America is the aspect that veterinary care is not the one and done solution, right? And I appreciate in my day-to-day life working with livestock in the US the importance of good husbandry year round and actually day by day as having a great impact on animal welfare. I think we can look at that through physical health, mental. There are some newer information about mental health in livestock and certainly equines as well, that is very much impacted by the care practices provided by their owners or their caretakers. And so that's what I like about One Health and if you will, the One Welfare phenomenon, is that there are a lot of places for veterinarians to be involved, and I think there are a lot of places for non-veterinarians to be involved, and we struggle with, I should say the working equids struggle with nutrition in many of the regions where Equitarian Initiative has programs, and it's a very, very clear, there's a very clear link there as well, in my opinion, to human nutrition in many of those areas. So in some ways this is low-hanging fruit, but in other ways it's a very difficult problem to come at, and it's a very difficult problem that I don't think we've really sorted out the answer to yet. But I guess I'll just stop there, not to end on a sad note, but I think I mentioned a few of the connections earlier in my presentations as well. And I think ultimately, if we are preserving animal welfare through not only preventive veterinary care, healthy nutrition, and good handling practices, we are hopefully reducing the need for antimicrobial use and other things that can really impact the health of the entire planet.
Well said. Jennie, do you have anything to add to that?
I don't think so.
Perfect. I'm curious and I'd like to hear from both of you on this. And Jennie, we'll just start with you, but in your opinion, what does One Health need more of?
It needs more experts from more disciplines, recognizing that it takes time and effort and money and energy to collaborate on the front end of things. So, the biggest thing, it's an approach. So, to solve complex challenges. And we all know it's like a lot easier just to call one person and just to, get one person on the phone and just let's go do this versus, recognizing that there's all these different stakeholders involved and the time and effort that it takes to pull One Health teams together, which is a lot of different folks from a lot of different disciplines that have sort of different priorities and different mandates, takes a lot more time and effort and energy and money, frankly, for people's time. And at the end of the day, it's been shown, so the World Bank has done some research that shows, like, at the end of the day, there are cost savings to a lot of One Health projects, but it's on the back end that you see those. At the front end, it takes a lot longer. So I think more people working in this space and recognizing that it's a little bit harder to get some of these things off the ground. And it's not going to happen overnight, or sometimes even like a year later. It takes a while.
And Angie, same question to you. What do you think One Health needs more of?
Well, I'm really just learning from Jennie. And so my answer was going to be staying power, where individuals with an interest in this theme, staying with it in long-term programs, which maybe I can even say with a focus on one particular geography of interest, which is meaningful to that individual for whatever reason. Maybe you live there, maybe you're partnering with individuals there, maybe the working Equids there have your heart. But I think the ability to see a place, know it very well, and keep going for years or decades in trying new approaches and bringing in, like Jennie said, more people is one way in which One Health has lived out in the Equitarian Initiative. The other theme I think that One Health needs more of is, and this has been said a bajillion times tonight, is just communication in all of its forms. I think that's what I've learned the most from working in this space, and it's humbling all of the time that I'm just not good at it yet. But I mean, communication across sectors and cross-cultural communication, all of those things, I think, is what has the potential to make One Health a really great movement.
Wonderful. Yeah, I think that, listening to you guys tonight, it's such it just speaks so clearly to the importance of community engagement, partnerships, and kind of the cross-pollination between the variety of people and professionals and industries that are working towards this. So we're getting close to our wrap up. So the last question I have here is, what resources do you guys recommend to those who want to get more information about One Health or the One Health perspective and want to educate themselves? Where's a good kind of 101 to get started for folks who haven't really worked in this space, or at least unknowingly haven't worked in this space?
Well, I put some links in the chat. So there's not just one health center. There's lots of different groups that are doing this. You can do a One Health project without calling it One Health. It shouldn't feel intimidating. But there are some good groups out there. The One Health Commission has sort of has had an online presence for a long time, and I would say they're like the Encyclopedia Britannica now at this point of sort of different One Health resources and projects. Not too much working equine flair there, but I think good high level overview. I put the UN document link in there as well. So yeah, I think those are probably good places to start. What about you, Angie? What do you think?
That sounds great. The only thing I have to add, I don't have any favorite One Health resources which have not already been mentioned, but like Jennie said, you may be already doing this type of work. If you are interested in carrying out a One Health type approach in a specific animal health program that you have, or a specific animal welfare program that you have, speaking from not my own successes, but the successes of the organization, I can say that seeking out other nonprofits in different spaces than your own has the potential to make a lot of impact. So organized groups of people, whether that be, non-governmental organizations or associations of different disciplines, and reaching out to them can be one way of carrying the One Health approach in whatever work that you're already doing. I mean, just the good old-fashioned Google search can be a start, and then just asking who to contact next has been a way that I think some of these partnerships between the Equitarian Initiative and some of the organizations who are true movers and shakers have ultimately came about.
Wonderful. Well, we are at the top of the hour, just a little past. But if anybody is familiar with EI, we're known for being never quite on time, always just a little over, because we get so excited about all of these discussions and concepts. And frankly, I could talk with you guys about this for hours. It's really fascinating. I know we're just scratching the surface of this, but I really want to thank Dr. Angie Varnum and Dr. Jennie Lane for joining us tonight and taking the time to share their knowledge and their experiences as that applies to, the veterinary perspective, but really just as a whole, or kind of speaks to each of our humanity and how this impacts us in ways that we don't always necessarily see, know, think, or feel. But I think that the more we learn about this field, the more we can hopefully it encourages us to continue learning and exploring. So thank you both. As I said earlier, we will have our next webinar to TBD on our topic and audience, but that will be in June. And so you can just look through the regular channels through that via social media, the mailing list, etc. So thank you all so much for joining us tonight, and we hope you have a wonderful evening. Thank you again to our panelists, and we enjoyed the shared learning, so take care.
Thank you. Bye-bye.